Hello, I'm Ulrika Wolf, a clinical hypnotherapist and strategic psychotherapist. In this briefing, I want to explain what strategic psychotherapy is, how it differs from supportive counselling, how it may be integrated with clinical hypnosis, and when referral or collaborative care may be appropriate. Strategic psychotherapy is the term used for a therapist-led, collaborative, and goal-focused way of organizing treatment. My approach is informed by the model taught by the Institute of Applied Psychology, including its integration of Ericksonian hypnosis, and by the developing professional framework of the International Strategic Psychotherapists Association. It's also influenced by the work of Milton Erickson, Bill O'Hanlon, Gordon Young, and Michael Yapko. The term strategic psychotherapy has been used across different therapeutic traditions, so it does not refer to one universally standardized treatment protocol. Within my practice, it describes the way I assess a difficulty, identify what may be maintaining it, and develop an individualized therapeutic strategy. People often arrive in therapy with a good understanding of what they're distressed about and what the problem is. They may know when the problem started, what triggers it, how it affects them, and what they would like to change. They may also have spent a great deal of time thinking about it, talking about it, or trying to reason their way through it. That understanding can be valuable. However, knowing what the problem is about does not always explain why it continues. Strategic psychotherapy looks at both the content of the problem and the processes that may be maintaining it. For example, the content of a problem may be fear of public speaking. The processes maintaining it might include mentally rehearsing failure, monitoring physical sensations, interpreting ordinary activation as evidence of losing control, avoiding eye contact, over-preparing, repeatedly reviewing perceived mistakes afterwards. The problem is not simply that the person feels nervous. The relevant clinical question is what happens before, during, and after the nervousness, and how those responses may contribute to the pattern continuing. An important part of strategic psychotherapy is helping the client develop useful distinctions. This might include distinguishing a thought from an observable event, a prediction from an outcome, discomfort from danger, possibility from probability, reflection from rumination, preparation from repetitive checking, protection from avoidance, or immediate relief from a response that supports longer-term functioning. These distinctions are not always objective or absolute. What is helpful, proportionate, or workable depends partly on the person's actual circumstances, their goals, values, responsibilities, and environment. The therapist's role is not simply to declare that a client's thinking is wrong or distorted. Instead, we examine how a particular interpretation or response is functioning. Is the person treating a possibility as a certainty? Does the response protect them from a genuine current risk? Or does it repeatedly confirm a feared prediction? Does the strategy help them act in accordance with their goals? Or does it provide short-term relief while making the longer-term problem more difficult to change? A distressing thought may be accurate. Another thought may be possible but treated as inevitable. A reassuring response may feel helpful in the moment, while reinforcing repeated reassurance-seeking behavior. The therapeutic task is to consider accuracy, context, consequences, and usefulness, rather than just imposing positive thinking mindsets. Supportive counselling may provide validation, encouragement, emotional expression, practical assistance, and help with coping, and these are important therapeutic functions. Strategic psychotherapy has a different primary emphasis. Alongside asking what happened and how the client has been affected, strategic work also asks what happens immediately before the difficulty intensifies. Where does attention go? What meaning is assigned to the experience? What does the person then do internally and behaviorally? What short-term effect does the response have? And how might it contribute to the problem continuing? Supportive and strategic work are not mutually exclusive. A client may need emotional support, practical help, and an active change strategy at different stages of treatment. The question isn't which approach is categorically better. It's what kind of therapeutic work is appropriate for this person at this time for this goal. Clinical hypnosis may be incorporated where it serves a clear therapeutic purpose. It may support focused attention, guided rehearsal, experiential learning, therapeutic imagery, tolerance of sensations or emotions, and the consolidation of skills developed during psychotherapy. It's not used as a standardized script or a standalone approach. For example, a person experiencing performance difficulty may understand intellectually that activation is not the same as danger. However, when they begin speaking, their attention may turn inward. They may monitor their voice, their heart rate, or their facial expression. Normal activation is then interpreted as evidence that they are failing or losing control. Strategic psychotherapy can help identify that sequence and interrupt it. Clinical hypnosis may then be used to rehearse directing attention back towards the audience and the task, allowing some activation to be present, slowing the response, and recovering from moments of discomfort. The aim is not to guarantee calmness or eliminate every physical sensation. It's to help the person practice functioning more flexibly while activation is present. The hypnosis serves the therapeutic strategy. People may seek focused strategic psychotherapy for concerns including stress, overwhelm, and rumination, sleep-related habits and arousal, confidence and performance difficulties, specific fears and phobias, smoking or vaping cessation, habits and behavioral change, difficulty adjusting after a significant life event, selected pain management goals as part of appropriate medical care, medically assessed gut-brain symptoms, or difficulty following through with an intended behavioral change. This is a description of common help-seeking goals. It does not mean that strategic psychotherapy or clinical hypnosis has equivalent evidence for every presentation. Suitability depends on the individual client, the processes contributing to the difficulty, and the broader clinical context. Treatment begins first with assessment. I consider what the person wants help with, what they've already tried, how the difficulty operates, relevant medical and mental health history, current treatment, medications, safety, stability, and whether another practitioner should remain involved. The initial formulation is treated as a clinical hypothesis rather than as a fixed explanation. It may change as we gather more information and observe how the person responds. Sessions may involve focused questioning, attentional exercises, behavioral experiments, guided rehearsal, clinical hypnosis, and agreed practice between sessions. Between session work might include observing a pattern, practicing different attentional responses, listening to an agreed hypnosis recording, approaching an situation more gradually, or testing a specific prediction. Progress is reviewed against the client's agreed goals and functioning. It's not measured only by whether the client felt relaxed during hypnosis. A formal referral is not generally required for private appointments either. However, a referral letter can be helpful where there's relevant medical or psychiatric history, current medication, diagnostic uncertainty, identified risk, or a defined adjunctive treatment goal. Clients should remain under the care of their GP, specialist, psychologist, or psychiatrist where ongoing medical, medication, diagnostic, or specialist mental health management is indicated. Strategic psychotherapy and clinical hypnosis do not replace necessary medical investigation, prescribed treatment, emergency care, or specialist psychological or psychiatric support. With the patient's consent, I may communicate relevant information back to the referrer, such as confirmation of attendance, the general therapeutic focus, progress relevant to care, or a recommendation for further assessment. A diagnosis alone does not determine whether someone is suitable for strategic psychotherapy or clinical hypnosis. Further assessment, specialist involvement, or another level of care may be required where there's acute suicide or self-harm risk, active psychosis, significantly impaired reality testing, acute mania, delirium, severe instability, cognitive impairment affecting consent, substantial dissociation, severe substance intoxication, or withdrawal, diagnostic uncertainty, or complex medical or psychiatric comorbidity. A history of trauma, anxiety, PTSD, a personality disorder, or another mental health condition is not automatically a contraindication, but suitability to work with it depends on the person's current presentation, stability, their goals, existing care, and the practitioner's competence and scope. At the moment, some of these things would fall outside my scope, and so it is worth discussing presentations further before making a referral if you're concerned. Hypnosis should also not be used to establish the historical accuracy of allegedly recovered memories or determine facts for legal or forensic purposes. Strategic psychotherapy is less about applying a clever technique and more about organizing therapy around a clear question. What is this person repeatedly noticing, predicting, interpreting, avoiding, or rehearsing that may be keeping the difficulty alive? And what different response could be understood, tested, and practiced? In my work, clinical hypnosis may form part of that strategy. The quality of the work depends on careful assessment, a clear therapeutic rationale, informed consent, client participation, ongoing review, and an honest recognition of scope. Thank you for taking the time to learn more about strategic psychotherapy and how it overlaps with clinical hypnosis. You can read the full briefing on the online hypnotherapist Clinical Briefings Hub.
The Clinical Briefings Hub is a free, dedicated professional resource for GPs, specialists, and allied health practitioners who would like more detailed information about clinical hypnotherapy, strategic psychotherapy, and referral considerations. The Clinical Briefings Hub is a separate space that allows you to explore the complete evidence-informed briefings behind the information on the main website. When you open a briefing, you will see the estimated reading time at the top so you can decide whether to read it now or later. Each briefing also includes call-out summaries that highlight important clinical points and practical information for quick review. The content is divided into clear sections, allowing you to move to the information that is most relevant to you. You can also expand or collapse sections as needed and skip to the sections that are of most interest. You can also review the supporting sources in the footnotes and click directly through to available research, professional guidance, and further reading. The complete briefings include all three collections, foundations, clinical presentations, and the referral process. And you can see there's far more here as well for you to access. Health practitioners can freely access the clinical briefings by subscribing to the Online Hypnotherapist professional updates.